this is Andrea Sheely, and this week we are going to talk about interdisciplinary teams. So the first question reads, define what an interdisciplinary team is. An interdisciplinary team is members of a team that are going to work together to provide the best quality care for the patient. Members may include nursing staff, therapists, physicians, but they should also include the spouse and the actual client themselves. It's important to include these team members. Even though they don't have the medical background, they are the main focus of why we are there, so their opinion does need to be included. Some clients may require specialists in their IDT team. For example, this might be a neurologist. So making sure that every client has an IDT team that is specific to that client's need. Team members should also communicate on a regular basis important client information. This could include medical changes that occur, say the client fell and broke his hip. Everybody on the team needs to know this. This might also include things like changes in therapy service. Maybe the client was only receiving 3 days of therapy and now they're getting a little bit better and we bump it up to 5 days. Other team members do need to know this. For example, nursing would need to know that so that they can make sure the client has their pain medication in the appropriate time every day of the week. Regular communication provides the team with a larger picture of what the client is looking like, and making sure that we're all on the same team and we're kind of looking to the future so we can get this client as well as possible. So the second question reads, what did you learn this week about interdisciplinary teams? So one thing I believe I learned this week is just how important every team member is. Some team members might kind of disregard other team members, and this can be for tons of different reasons. They do or do not have a degree, or how many years of experience the other team member may possess, or even based off a discipline. I know in the skilled nursing setting, sometimes nursing and therapy don't always get along, but it's always important to remember that we are there for the client, and whatever we need to do to just put our differences aside and provide quality care for the client is what we need to ultimately make our goal. So the next question reads, as the OTR, what is your role on the interdisciplinary team? So the OTR plays a huge role on the interdisciplinary team, especially in the skilled nursing setting. I know a lot of times we're trying to get our clients back to wherever they were before, and a lot of times that's living home alone or home with a spouse who maybe cannot provide the same amount of care that we can as therapists. So as the OTR, we are in a supervising role, and we are responsible to make sure we're communicating with other team members, all sorts of things like what that client's level is, how well they're doing, if we see anything unusual. For example, if this client is starting to develop a bed sore because they're spending a lot of time in bed, it is our responsibility to communicate that to the nursing staff. Hey, I just worked with Mrs. Jones and I noticed she had this little spot on her bottom. I think we need to check it out and we really need to keep an eye on it. We want to make sure we're not developing any bottom sores, and making sure that the client is changed as frequently as possible so we can keep them dry and clean. It's all about our approach though when we're doing that, to make sure that our communication is well received. Also, another thing, as an OTR, we should be communicating functional levels to the floor staff and the nursing staff. The nursing staff isn't qualified to determine what level this client is. So when we go in and we do our eval and we transfer this client and we get them in the shower and we put them on the toilet, it's our responsibility to then come back and say to the nursing staff, hey, when you transfer Mrs. Jones, make sure you are using max assist, you need that second person there for support, or make sure we're using our gait belt. Make sure we remember that their right lower extremity is non-weight bearing. Do you need me to show you how to transfer her? These are just basic expectations as an OTR to make sure we're working as an interdisciplinary team. And the fourth question reads, in your current workplace, what are areas of concern regarding an interdisciplinary team, and what are some suggestions or strategies you have to improve these concerns? I'm currently only working PRN, so it is important as an interdisciplinary team at any level, whether you're full-time PRN, but I used to work as a director of rehab, and this is where interdisciplinary teams was just really open to my eyes. I feel like as a CODA, I did not realize how important interdisciplinary teams were, like how often they met, how often they talked about clients, how important care plans were. I had no idea the amount of effort and just quality of care that we're looking to provide to these clients. I was kind of that therapist who got in, did their treatment, communicated to the nurse if I needed to, and went home. So being a DOR definitely opened my eyes. One thing I saw frequently is, I don't know what other term to use, so I'm lower level staff, staff that works with the client on a regular basis. So our CNA staff, our young CODAs and PTAs and those staff members, they are not educated the best on what an interdisciplinary team is and what is important to communicate and why it is so important. For example, say a CNA goes in, they're working with Mr. Jones, and Mr. Jones reports he's having pain in his arm, and the CNA just says, okay, roll over, let me change your brief, but doesn't really communicate that, doesn't explain, oh, this is like a sign of a heart attack, and then something ends up happening later in that shift that could have been prevented. So I just feel like the biggest suggestion I have for interdisciplinary teams is also to educate other team members how important communication is, to be respectful about our education. It's always difficult to kind of counsel somebody, kind of let them know, hey, when this happened and he told you that his arm was bothering him, you needed to communicate that to us. One thing I think that would help would be a mentorship program. I had a wonderful mentor. She is an OTR, and she mentored me on becoming a director of rehab, and I could have not asked for any better of experience. I learned such a great deal, not only about becoming a director of rehab, but also about becoming an OTR and what things I should be looking for and what's not as important or as significant, and what are we focusing on, how are we challenging ourselves. So definitely a mentorship program is a great way to just improve our interdisciplinary teams and make sure that we're getting everybody on the same page. Anybody who's working in the facility is really ultimately part of the interdisciplinary team, and we need to make sure that we're also just providing that quality care that every client deserves. I know if my grandma was in a skilled nursing facility, I personally would want to make sure that her nurses are communicating with her therapist and her doctors are communicating well with her nurses, and that they're sitting down and having those weekly meetings and truly discussing what our discharge plans are and what are we doing next and what do we need to do to get their pain level down, or what is our next step, and just making sure we're working together as a team. Thank you. Have a great day.